Mercy Medical Center has a $2.5 million grant through their parent company, Trinity Health, to fund programs that promote health and well-being in Springfield. Mercy will team up with other organizations, including LiveWell Springfield, to target 6 health issues, including smoking, obesity, improved access to nutrition, and more. Connecting Point correspondent Carolee McGrath sat down with Doreen Fadus, Executive Director of Community Benefit and Health for Mercy Medical Center, and Jessica Collins, Executive Director of Partners for a Healthier Community, to find out more.
It's called the Transforming Community Initiative, and it's actually coming through our parent organization, Trinity Health, out of Livonia, Michigan. And we are one of the 6 grants that they have awarded in the country, and we'll be receiving $2.5 million over the next 5 years to work on what we're calling the social determinants of health, working on making the community healthier through many different efforts, whether it's healthy lifestyles and working on food and nutrition issues, safe streets. And Mercy will be the convener of the grant, but it's going out to our 6 partners, Martin Luther King Center, HAP Housing, Square One, the Food Policy Council, Partners for a Healthier Community, and Pioneer Valley Planning Commission. I'm glad I remembered all 6 of them. Yeah.
So it's a big partnership. Jessica, I know you're with Partners for a Healthier Community. How will your organization be involved?
So Partners for a Healthier Community will help with the convening, as we've been facilitating the LiveWell Springfield movement for the past 9 years. It's made up of over 20 different organizations, and we've implemented multiple strategies over the past decade around food and fitness. So we will be helping with the convening, and we'll also be doing the evaluation for the 5-year project, 3 to 5 year project.
And what do you see as one of the bigger problems in Springfield? I know you talked about nutrition. That seems to be a real hot topic. Mm-hmm. How big of a problem is that?
Springfield has a lot of wonderful assets. With regard to food, we have some neighborhoods that are food deserts. We have limited access to fruits and vegetables for many, many families that rely on public transportation, have to get to a grocery store, multiple buses. You can only carry 2 bags. You've said you're a mom of 5. Imagine having to take your children on public transportation to go grocery shopping, how challenging that is. And we know that in bodegas, corner stores, that there isn't a lot of options for fresh foods. It's sort of a catch-22 that these businesses are in because of volume. So if they buy a lot of fresh produce, then it doesn't always get purchased, and so they have a conundrum about what to offer, how much people will buy, and waste. So working on that is really kind of a 5 to 10 year effort to figure out how to get better access for these families.
And I know another big problem is making sure kids are staying active. Mm-hmm. When we were little, right, our parents would just let us roam and run around. But now, parents are a lot more cautious. They're afraid that there might be a stranger out there, or somebody might swipe them. Mm-hmm. So kids are not doing that playtime anymore. Mm-hmm. That has to be part of the initiative as well.
Mm-hmm. So looking at food and nutrition at in Square One, looking at the younger children or the children in the after-school programs, and the Food Policy Council, the Springfield Food Policy Council, will look at the nutrition in the school systems, and they'll look at activity levels in the school systems. I mean, overall, this is an attempt to look at Springfield and look at both affecting the environment, making some changes in the environment, but also affecting policies. Do you affect a policy on school nutrition? Do you affect a policy on tobacco in the city? Do you affect a policy on safe streets, looking at bike path, walking, curbs painted for access up onto sidewalks? So it's trying to change the environment, but also trying to change the policy. And also going along with this grant that we got is the chance for the city to apply for capital loans. Trinity Health is having $40 million in capital loans that is available to these 6 grantees across the nation that got the grant. that could affect everything from looking at a grocery store, right? That is one of the initiatives, looking at a grocery store in Mason Square, looking at expanding maybe how to get fresh produce into the schools. How can we work with the school system to do that? A greenhouse has been talked about, looking at herbs and selling them in the city, hiring low-income people. So these agencies in the LiveWell Springfield initiative will have a chance to look at that $40 million capital investment as well. So we're excited. We're also going to be sharing the learnings with the other 5 grantees from New York, Maryland, New Jersey, Idaho, and Illinois. So we'll be getting together, finding out what they're doing in their city. So it's really it's cutting edge, it's national.
So there's also a tobacco component to this grant. Can you tell us about that?
Yes, so nationally there's research out that shows that if you can keep young people from trying smoking or becoming smokers by the age of 21, it's likely they will not become smokers. Tobacco is a huge risk factor, causes so many diseases and poor health outcomes for people's lives. That this exciting effort is to educate and do marketing to young people about it's called Tobacco 21, the national movement, so keeping people from trying. And the positive thing is that in our 8th grade survey that we did, 75%, I believe it was, over 75% of these 8th graders said they had not smoked in the past 30 days, which is very, very exciting and gives us something to work with.
But you also have those e-cigarettes that seem to be becoming very popular now, which I was surprised at. I was like, oh, who smokes anymore? But I'm hearing at the high school level especially that kids are really getting into that. Would that be a concern?
Definitely. I mean, that's part of the whole initiative, to look at it as a whole. And besides the goal in the TCI grant, it's also a goal of Mercy Medical Center to look at tobacco, because you're right, we have so many challenges sometimes in our community. Tobacco is just kind of moved away, but it's a huge health crisis, and really to look at youth, and that's what the Martin Luther King Center and HAP Housing will look at, is the whole tobacco piece. And frame it as we go, and you know, try peer education, try looking at support for people who want to quit, whether it's e-cigarettes or tobacco in general. So yeah, we're looking forward to seeing what we can do.
Great. Doreen and Jessica, thank you so much for joining us today.
Thank you.
Thank you.